UN agencies are calling for urgent intervention in Yemen, where a deadly cholera outbreak is set to become the largest ever recorded in a single year. War there has cut off access to clean water, and millions of people, it says, are in need of aid. Soo-young reports.
The cholera outbreak in Yemen has gone from bad to worse, with 5,000 people falling sick every day, according to the United Nations. Since April, the number of suspected cases has surged to more than 400,000. 1,900 people have died, a third of them under the age of 15. Small children are the most vulnerable to contracting the disease, with more than 1 million children under 5 living in highly infected areas. While cholera is an easily preventable and treatable disease, more than 2 years of war has destroyed infrastructure and health services, as well as access to food and clean water.
For example, almost half of the health facilities are no longer functioning because they're partly or completely damaged. Doctors and nurses are not coming to work because they have not been paid and looking for income elsewhere. Garbage is piling up, and water treatment plants are functioning partially because of lack of money for fuel to fuel the generators.
With the war in Yemen showing little signs of abating and the approaching rainy season expected to worsen the transmission of diseases, the United Nations says the cholera outbreak is far from over, as millions are trapped in a cycle of sickness and poverty. 18 million people are in need of humanitarian aid, and 70 million of them, that's 60% of Yemen's population, do not know where their next meal is coming from. The UN Development Programme's country director for Yemen compared the situation to that of an accelerating bus certain to crash. He said time is running out for finding solutions to alleviate the crisis before it runs off a cliff. The UN Health Agency has requested $64 million this year to respond to the cholera outbreak in Yemen, but only a sixth of that sum has been provided. Soo-young, Arirang News.